Hello everyone. This week we'll start evaluating articles for evidence, starting with therapies. The best studies are the RCT, so this lecture is about the randomized controls trials. We'll get to other types of studies later. I'm giving you some checklists originally created by the Critical Appraisal Skills Program in Oxford, England. The idea is to streamline the review process a bit. For now, I've included the checklist for RCTs. There are also checklists for case control, cohort, diagnostic, and review papers. Each checklist has a series of questions and tips for figuring out if that particular article will help you. And you can also use this method to critique any new articles that come along, so when something is reported in the media or by various organizations, you can locate the original articles and determine how accurate those claims are. So first you want to know what question the study is trying to answer. Of course, the title should be your first and hopefully very obvious clue. You want to know what the study is focused on, a specific intervention, preferably one intervention, because combinations of interventions make it difficult to know which outcomes were actually the effective ones. Remember when we talked about selection bias last week? Go to the methods section of the paper. There should be a description of how the participants were selected. There may also be a flowchart. Look for how they advertised the study and what were their exclusion criteria. Do the participants have any specific characteristics? Also, how are the patients or participants allocated to treatment and control groups? They should be randomized. If not, what were the determining factors for allocation into the groups, the treatment group, or the control group? If this isn't randomized, there can be a bad bias. Look at the tables to compare the groups in the study. They should be balanced, about the same number of participants, similar characteristics, and proportion of male to female. Are the ages similar? Are the baseline exam or lab measurements similar in each group? Randomized control trials should be blinded whenever possible. Look in the methods section of the paper again. Easier to do with medications or dietary supplements or things in pill or tablet form because the placebo can look just like the treatment. But look at that placebo while you're at it. What is it? You don't want to see a placebo that itself could have the effect. This is something that I've seen in nutrition studies. For example, I've seen studies on fatty acid supplements that use olive oil as a placebo. But there's a potential problem because the monounsaturated fats in the olive oil could have an effect, and you don't want the placebo to have any actual physical effect. It's much more difficult with foods. It's hard to hide broccoli or come up with a placebo green bean. Believe me, if it were easy, my kids would have eaten more of them. Also, check out the placebo group's dietary instructions. Often the placebo group is given generally healthful diet instructions, but that may be better than what they were eating before. You might also find therapy studies that involve some sort of physical medicine, like physical therapy modalities or even acupuncture. You can't double blind those studies, so look at what they use for a control group or placebo. Also, in the methods or results sections, find out how many participants completed the study. If one group has lost many more participants than the other, there may be a lost follow-up bias. And even though a subject drops out, they need to be considered in those final results. Also, were the outcomes analyzed by original groups, or did they switch participants around somehow? Do they explain why they did that? How was the data collected? Did they use measurements or questionnaires? If they used questionnaires, are they validated? Did they use the same measurements for both treatment and control groups? And how big was the study? Bigger studies mean more reliable results. Next, what are those results and how precise are they? What did they measure? Changes in risk? Changes in the group or mean of something like blood pressure scores or questionnaire values? And look at the size of the p-value. If it's present, it should be less than 0.05. Are the confidence intervals or standards of the standard error of the means there? Are they narrow or are they large? And do they overlap? The bottom line, do you believe the results? Big effects are hard to pass off as chance, but small effects within huge confidence intervals or very small changes in a risk or whatever is being measured, those probably don't mean much. And look at that number needed to treat. Does it make sense clinically? Does the study design seem acceptable? Did they use the best intervention? Sometimes dietary supplement studies, for example, use different forms of a substance, like chondroitin sulfate or chondroitin hydrochloride. Might that difference matter? So now what? If you don't believe a study is valid, then you don't want to use it for evidence. If you do believe it, how do you use it? Think about how a patient could use this information or how it fits into a paper you're writing. Is there enough evidence for adding the therapy? Like, are there similar studies with similar results? Or you can look for review papers. If not, what could be causing the different results?